lift from one chair to another chair, and what we're using is a split leg sling. I like the split leg sling because it's easy application to the patient and to the caregiver, whoever is doing the lifting. So it makes it easier to apply it. And with this type of sling, sometimes when you're putting patients in lift, they are in a lying position. This brings the patient up into a seated position. Now, picking the right size is very important as well. You don't want a sling that's too large for the patient. If the sling is too large for the patient, then it's going to have the patient dipping down further. So this is a medium sling, which is pretty much the right size for my demonstrator here. So simply bring it behind them. You're going to sit up just a little bit. We just want the back of the sling to go down right there to the smaller back. Okay. Go ahead and sit back. And this particular sling comes underneath the thigh. You just want to make sure you don't have any wrinkles. Same to this side. Right. And then once we get ready to lift, we're going to crisscross to keep her legs abducted, meaning keep her legs together and not spreading apart. So we're coming from a forward facing. This is the Vive Medical full electric lift. Medicare will only pay for a hydraulic lift, which is what you pump, but we carry the Vive full electric lift. It's just a little bit more, but patient comfort is and caregiver comfort is the key with the full electric lift. So now we're going to connect the demonstrator to the sling. So we have two sling bars here. Then the leg straps. And they are crisscrossed to keep her legs together. I'm going to bring myself to the patient care zone here. The patient, as long as I'm in the patient care zone, I can protect their head. I can monitor for pinching, make sure that all of the straps stay connected, because when you're dealing with patients, you don't want to take them too fast, especially elderly patients. I'm only lifting her to the highest point necessary, so I don't have to suspend her way in the air, but I do want to lift her high enough where she can clear the arms of this chair. You feel comfortable?
Yes.
Okay. You don't feel like you're gonna fall?
No.
All right. And remember, as long as she's attached to the lift, she is safe. And then center of gravity pushes the lift back. And continue to let the bar down while I can disconnect the straps. So we just want to watch the bar and make sure it doesn't hit her in the head. We're going to move the strap here. Have her to lean forward just a little bit. All right, and there she is, comfortably sitting in a chair. Remove the sling. Less stress on my back from lifting the patient. Less pulling and tugging on the patient, which protects their skin.